Hi guys! Today I will be presenting my project on the history of electronic health records and their use in healthcare. So in this presentation I will be discussing what electronic health records are, why electronic health records are important, and the impact of electronic health records in healthcare. So, electronic health records were created in the mid-1960s, and they began to be used in a major way in the 1970s. The very first electronic health record system was implemented in 1968 by the Massachusetts General Hospital, and it was called the Computer Stored Ambulatory Record. And what made this record a lot different from, kind of starter tester electronic health records was that with this electronic health record system, the user was able to separate out the health information from the other information. So in previous electronic health records, everything was kind of, mishmashed together. There wasn't a way to just select, financial records, or just select patient records, or just select laboratory results. So with this system, there was actually like a separate place for each type of healthcare data. And the first kind of widespread use of electronic health records began in 1970 and was with the Department of Veterans Affairs with their VISTA system. And the electronic health record, began to be used more frequently and more widely across the United States throughout the 70s and the 80s. And then in 1987, the organization HL7 was created. And what this organization aims to do is it aims to standardize the different components of electronic health record system. It is an international organization, and what they mean by standardize the different components is a lot of times with electronic health record systems, each component is made by a different vendor. So the place where you enter lab results, that section is made by a different vendor compared to where you enter patient information, or compared to where you enter discharge information and stuff like that. And so what they aim to do is to have a standard set of kind of rules and regulations to make the electronic health record system run a lot smoother, and to make sure it's not too confusing for people. So electronic health records are incredibly important because unlike paper health records where some of it might get lost, some of it might be stored somewhere else, with electronic health records everything is in one place. And so you can, from an electronic health record, you can access laboratory data, x-rays, pharmacy orders, when they've had surgery, if they're going to have surgery, and general overviews of the patient. And so it provides a better overview so that when a doctor, nurse, radiologist, pharmacist sees this patient, they're able to get a better overview of the patient, and they're also able to make a more detailed examination because they know a lot more about the patient in comparison to if they were just using paper records. Also, with a lot of electronic health records, they allow communication between providers. So with a lot of systems, what you can do is say, you go see one provider for a lab result. The lab tech can take those lab results and send them to your physician, and they're able to get results a lot quicker which means that they can treat any problems a lot faster. Electronic health records also help to create a more efficient medical practice. Because of the fact that they are electronic, you don't need all that room and all that storage space for if it was paper. You're not having to have big old thick folders for each patient. You're not having to create new paper records every time someone is readmitted or every time you see them. With electronic health records, everything is kind of in one place. And electronic health records also tend to be a lot more secure. Because of the fact that it is electronic, it is usually on some sort of computer, you're able to password protect it, encrypt it, things like that. And also with electronic health records, in terms of security, you're able to hide things from people. You're able to make sure that only a couple of select people are able to view the records, unlike paper records where everything's, in like a filing cabinet or everything's just kind of like out there. You can hide electronic health records a lot better. So the impact of electronic health records, just kind of in general, the impact has been that, obviously facilities are able to store a lot more information about patients. They're able to access this information a lot quicker. They're able to have, their doctors, nurses communicate a lot easier. But in terms of kind of specific impacts, the most major impact that electronic health records have had has been through the HITECH Act. And HITECH stands for Health Information Technology for Economic and Clinical Health. It was implemented in 2009, and what the Act aims to do is to, generally improve the way that healthcare is delivered. But specifically, what it aims to do is, to improve the way healthcare is delivered, but specifically through the creation and implementation of electronic health record systems. So what the HITECH Act has done is it provides a financial incentive for, doctors' offices, hospitals, outpatient clinics, things like, really kind of any sort of major healthcare setting. It provides financial incentives for creating and implementing an electronic health record system. And there were three stages to implementation. The first stage was mostly kind of, gathering data, cleaning up the healthcare data, making sure that the data would be ready to put into an electronic health system, kind of beginning stages of creating the system, making sure that the technology was there, making sure that everything was ready to go. And the second stage was, importing the information into the electronic system, making sure that obviously the information was correct, that the information was there. Also, a lot of quality reporting and a lot of reporting to agencies to make sure that all state, federal standards were being met. And then the third stage is is kind of more of implementation. It's implementation, and it's also kind of implementation and beyond. So what it is obviously, making sure the system is running, making sure that it's working, and most importantly, making sure that it's actually helping. So making sure that, in comparison to just using paper records or hybrid records or whatever the facility was doing, that just using electronic records is actually providing a better quality of care for the patient. And the last stage was implemented. The facilities were supposed to be in the last stage between 2017 and 2018, and so by now all the facilities that decided to participate in the HITECH Act should have up and running electronic health record systems. So, in summary, electronic health records, or EHRs, began to be used in the 1960s, and they're obviously still being used today. Electronic health records are important because they provide a more complete overview of the patient in comparison to paper records, and because they are more secure and they are, a lot more cost effective because you're not having to use all that paper and scanning and all that other stuff. And the biggest impact that electronic health records have had on healthcare has been through the HITECH Act. So here are my references, and the most effective one I think was definitely from the Health IT website, so y'all should check it out. So thank you for watching my presentation, and have a nice day.